Good afternoon and welcome everyone to the Senate Committee on Health and Human Services for the 83rd Legislative Session. Madam Secretary, please proceed to call the roll.
Senator Lang? Here. Senator Stone? Here. Senator Taylor? Present. Senator Titus? Here. Chair Doñate.
And I'm here and all members are present, and good afternoon and thank you everyone for joining us today. Just going to go over a few housekeeping items for those who are in attendance and watching virtually. Today we do have two bill hearings on Assembly Bills 36 and 42. If you wish to testify, you can go ahead and sign in at the table by the door to provide a business card to our committee secretary. For those that do not wish to testify, you may also want to sign in so that there's a record of who is interested in a particular bill. In the event the committee needs to contact you later. When testifying, please turn your microphones on to speak and off to listen, and we have listeners and viewers in Las Vegas and online as we are recording this meeting. And lastly, we ask for folks that are looking to provide public comments to be kept to 2 minutes so that everyone interested in speaking can be accommodated. And last but not least, we ask for folks to please turn off your electronic devices, especially your cell phones, or put them on silent mode during the meeting. With that, we'll start with our first bill, Assembly Bill 36, which revises provisions relating to Medicaid. And I will invite Administrator Weeks to please begin when she is ready.
Mr. Chair, committee member Stacey Weeks for the record. In front of you today, you have Assembly Bill 36. And this bill represents some of the recommendations from our Attorney General's office regarding ability for providers to request a hearing. Currently in our policy, they cannot request a hearing no later than 90 days after the notice of action. But the DAG feels, and we agree as well, that we need this in statute to ensure that we're able to not have providers bringing actions many years later, which impacts our budget and our program. We've had a couple of those instances where having it in statute would give us the clarity we need to ensure that we're able to receive appeals in a reasonable manner of time. Also in this bill, it allows us to apply some of our regulations that are adopted prospectively around hearings on or after January 1, 2026. And with that, I stand for questions.
Thank you so much. Committee members, any questions? Senator Titus.
Thank you. I appreciate trying to clear things up. I just want to make sure that the hearings are regarding the non-payment from providers, and they're protesting, requesting a hearing to relook at the denial of payment services, correct?
Mr. Chair, committee member Stacey Weeks for record, yes, but it could also include, for example, a denial in terms of a coverage or something that they've asked for their patient, and we've denied something in that manner, not just always payment.
Well, because I worry about if you have set amount of time, we don't always get, as a provider, reimbursed in a timely manner. And so does it start from the time that they've received their reimbursement or the denial versus the time they actually billed?
Mr. Chair, Stacey Weeks for the record, it would be a notice of action, so they would have been notified that something had been denied. It gives them a reasonable amount of time to respond and appeal, and it gives us a reasonable amount of time to be able to pay them back.
Good. I just wanted some clarity with that because it can be a long time before I see reimbursement after I've applied. I want to make sure it's not that 30 days. It might take a long time. So thanks for the clarity.
Mr. Chair, Stacey Weeks for the record, yes, I agree with you on that, Senator Titus. Thank you.
Thank you.
That's a very fair point. I've seen claims come back, 4 or 5 months later? Who knows? Yeah. Senator Stone?
Hey, thank you. Just to kind of follow up with Senator Titus's, it says it here that there could be some excruciating circumstances that allow somebody to go beyond the 90 days. Could you just give some examples of that?
Mr. Chair, Stacey Weeks for the record. Yes, there are those situations. For example, if a notice did get lost, the provider says they did not receive their notice. It could be a pandemic, another COVID situation. It gives us the opportunity to waive it if we think it's reasonable. Yeah.
Any other questions? Let's go ahead and move on to testimony. So if you want to take a step back, we are going to go ahead and open it up for support testimony. If you'd like to go ahead and support this bill, please come forward. I don't see anyone here in Las Vegas. AVH, is there anyone online?
Chair, there are no callers in support at this time.
Let's move on to opposition. Is there anyone in opposition? Seeing none here in Las Vegas. AVH, is there anyone online?
Chair, there are no callers in opposition at this time.
And last but not least, let's move on to neutral. Is there anyone that would like to testify in neutral? Seeing none here in Las Vegas AVH, is there anyone online?
Chair, there are no callers in neutral.
Thank you so much. Ms. Weeks, did you have any closing remarks? I'll go ahead and close this bill hearing and we'll move on to our next one, which is Assembly Bill 42. And I'm going to go ahead and open the bill hearing for this bill. This bill revises provisions governing the adoption of regulations for the administration of certain programs of public assistance. Now I'll invite back the team to present.
Good afternoon, Mr. Chair, committee members, Ann Jensen for the record. I'm the Innovation Officer here at Nevada Medicaid, and I'm here to present to you today Assembly Bill 42. So the intent of this bill is really to streamline the administrative process that we undergo as a division to adopt new regulation or policy that would allow us to expand healthcare benefits or make mandatory changes in a more efficient manner. So current law requires the division provide 30 days public notice prior to the intended action to adopt, amend, or repeal regulation. And this bill would allow us to instead provide 3 days notice if the intent of the regulation is a federal or state, to comply with a federal or state mandate or law, or to expand a benefit or service. It would also allow for retroactive application if mandated by federal or state law. So this will reduce our implementation timeline, which currently takes between 3 and 6 months, and allow us to ensure that our benefits are provided as quickly as possible. Importantly, this does not impact any of our ongoing stakeholder engagement, which includes our public workshops, which will continue throughout the process of this work. So ultimately, will help increase compliance and efficiency of our division. And with that, I stand for questions.
Thank you. So just more of a clarifying question. So for example, if the federal government were to say that all Medicaid plans throughout the country have to provide coverage for hearing aids, even though if we didn't, let's say we didn't do them, this would allow you to do the ability to do so because it's required under federal law in a shorter time frame, essentially.
Yeah. Mr. Chair, committee members, Ann Jensen for the record, that's correct, yes.
Thank you. Vice Chair.
Thank you, Mr. Chairman, and thank you so much. This seems to make a lot of sense. I just have a question around you said some of it would be retroactive. Can you talk about that a little bit? What does that look like?
Yeah, Mr. Chair, committee members, Ann Jensen for the record. Using Senator Donate's example, for example, the Medicaid program was required to cover hearing aids on January 1st, and our public hearing was conducted, for example, in February. We could retroactive that eligibility to provide coverage of that service effective January 1st.
Thank you, Ms. Jensen. That makes sense. Thank you, Chair.
Thank you. Senator Titus.
Thank you, Mr. Chair. Again, thanks. It seems like it makes sense, but I do need some clarification. Do your rules and regulations that you set into policy not have to go through Leg Commission for approval?
Chair, committee member Stacey Weeks for the record. No, we are exempt from regulations. We do policy essentially, even though they call it regulations in the law. We are exempt from that chapter, so we can be more nimble and quick and respond to the federal mandates.
Great, because that regulation thing had me, well, wait a minute here, how could you even set that up? So thanks for the clarification.
Any other questions? All right, let's go ahead and open it up for testimony if you want to take a step back. If you are here in support of Assembly Bill 42, we ask for folks to please come forward. I don't see anyone here or in Las Vegas. AVH, is there anyone online?
Chair, there are no callers in support at this time.
Thank you so much. Let's move on to opposition. If there's anyone in opposition here in Las Vegas, I don't see anyone. AVH, is there anyone online?
Chair, there are no callers in opposition.
And moving on to neutral testimony, is there anyone here that would like to testify in neutral? I don't see anyone here in Las Vegas. AVH, is there anyone online?
Chair, there are no callers in neutral.
Thank you so much. Ms. Weeks, is there any closing remarks? You can take your time. This is probably the fastest meeting we've done.
Chair, committee member Stacey Weeks for the record. I just wanted to say thank you guys for hearing our bills and moving them forward. Both of them are hopefully going to make our process cleaner, more transparent, and faster. So that's the goal. So thank you.
Thank you so much. At this time, I'll go ahead and close the hearing on Assembly Bill 42, which brings us to our last agenda item, public comment. Is there anyone that would like to provide public comment here in Las Vegas? I don't see anyone here. AVH, is there anyone online?
Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much. That concludes public comment in our last agenda item for the day. We finished in 9 minutes. I don't know the accuracy of that, but we'll double check.
I have a master's degree.
In
We'll
timekeeping, in timekeeping. Master's degree in timekeeping.
We'll have our next meeting on Tuesday. We have plenty of bills that have been referred to us from the assembly, and so for now the meeting's adjourned. Thank you so much for joining us.